Shelby, how are you?
Good, how are you?
Good, my name is Melissa. I'll be your student nurse today. I'm just going to be performing a physical exam. It should take no more than 20 minutes, okay? I'm going to start by checking your ID band. Good, now I'm just going to assess your orientation by asking you a couple of silly questions. So can you tell me your name?
Shelby.
Can you tell me the year?
2016.
Can you tell me where you are right now?
Hospital.
And can you tell me who the president is?
Obama.
Okay, good, good. Now I'm just going to ask you, how's your mood today? How are you feeling?
Doing good.
Good, and then I noticed your movement was good. You walked in here fine. Your mobility was good. Your skin color looks appropriate. Your hygiene looks appropriate, and your posture is upright. So I'm going to start the exam off by examining your scalp and your hair. So I'm just taking a look now. I noticed that your scalp is appropriate in contour. Your hair looks appropriate for color and properly distributed, which is good. I'm just going to palpate now the scalp and hair. I don't feel any masses or bumps or anything. The hair is nice and thick, which is good. All right, I'm just going to take a look at your face now. Notice the color is appropriate. The bony structures are aligned and appropriate, which is good. All right, I'm just going to test your cranial nerve functioning now. So I'm going to have you smile for me, clench your teeth, clench your eyes, wiggle your forehead, and then puff out your cheeks and stick out your tongue. Okay, good, good. All right, now I'm just going to evaluate your sensitivity to light touch by using this cotton ball. So every time you feel me move this, just point to the spot. All right, good, good, perfect. All right, now I'm just going to take a look at your face now. Again, the color is appropriate. I don't notice any scars or lesions. I'm just going to palpate the face. Let me know if you feel pain. No, good. And then now I'm just going to palpate the sinus regions now. So there's the frontal region and the maxillary region. All right, perfect. Now I'm just going to move on to the eyes now, assessing your vision using the Rosenbaum and Snellen chart. And your vision was 20/20, which is good. I'm going to take a look at your eyebrows and your eyelashes. I notice that the hair is properly distributed, the color is appropriate, everything looks symmetrical and aligned, which is good. Skin on your eyelids looks good, intact. Your blinking rates appear to be normal, which is good. All right, and now I'm just going to look at your conjunctiva. So I'm going to have you hold them down for me, please. Nice and pink, which is good. And then your sclera is nice and white, and your iris is round and appropriate in color, which is good. All right, so now I'm just going to test the symmetry of your eyes by using the 6 cardinal fields of gaze. So I'm just going to have you follow this pen light, please. Your eyes. All right, good. Now I'm just going to assess your pupils now by doing a couple of tests. So I'm going to shine the light on your pupils, and they both constrict. I'm shining the light on the bridge of your nose. The reflection appears in both eyes. I'm going to place my hand over here and shine the pen light across my hand, and both pupils constrict. And I'm going to have you focus on this object far and bring it in close. And the dilation and constriction is good. So the pupils, they appear equal, they're round, and they react to light and accommodation, which is good. All right, moving on to the ears now. I'm just going to inspect your ears. They look symmetric and properly aligned. The color is good, the shape is good. Looking at your external auditory canal, I don't see any discharge or lesions or anything like that, which is good. Okay, the skin over your superficial lymph nodes is no edema noted or red streaks, which is good. Just going to palpate now. Let me know if you feel pain. Nope. Okay, I also don't feel any tenderness or nodules or anything like that, which is good. So now I'm just going to test your hearing by first doing a finger rubbing test. So I'm going to have you close your eyes. I'm going to rub my fingers next to your ear and let me know when you hear it.
Okay. Okay.
All right, now I'm just going to assess your hearing by doing the Weber's test. I'm going to strike this tuning fork, place it on the center of your skull, and I want you to tell me if you hear it more on one side than the other or if it's pretty much equal.
Okay. It's equal.
Good. Now I'm going to use the otoscope to examine the inside structure of the ear. I notice that there's no excess cerumen and the tympanic membrane appears pearly, gray, and intact, which is perfect. All right, moving on to the nose, mouth, and oropharynx exam. I'm going to take a look at your nose. It appears symmetrical, the septum is aligned. I'm going to test for patency by having you plug one nostril and breathing in and out, and the other one as well. Perfect, good. Don't notice any discharge at all, which is good. I'm going to take a look at your nasal turbinates. Okay, dark red in color, which is normal. It's perfect. All right, moving on to your mouth now. I'm just going to take a look at your lips and they appear symmetric, nice and pink. Good. I'm going to have you open your mouth so I can examine your buccal mucosa. It's pink and intact. I'm going to have you smile so I can examine your gums. Pink and intact. I also noticed that you have all of your teeth properly aligned, nice and white, and good in hygiene, which is good. So now I'm just going to inspect the floor of your mouth and your hard and soft palate, so open up for me. Good. Pink and intact. I'm going to have you open your mouth and say ah so I can examine your tonsils and your uvula.
Ah.
Okay. Tonsils are appropriate in size. Uvula is midline, which is good. Don't notice any odor or anything like that. Everything seems normal. So now I'm just going to inspect your tongue. I'm going to have you open your mouth, move your tongue to the left and to the right. Okay, the tongue movements are good. I notice that the tongue is pink, glistening, appears normal. And then I would just palpate the tongue and gums next. I would evaluate the gag reflex, and then I'm just going to test your temporomandibular joint for movement. Okay, so I'm going to have you open and close. Okay, no clicking notice, which is good. All right, now I'm going to move on to the neck exam. Taking a look at your neck, I notice everything is properly aligned and symmetrical, no enlargements of the thyroid or the trachea, which is good. I'm going to palpate the trachea now. It appears to be midline. I'm going to do some range of motion on your neck, so I'm going to have you move your neck to the right, to the left, up and down. And then I'm going to have you put your ear to your shoulder. Good. Now I'm going to place my hands on your shoulders. I want you to resist to my touch. Perfect. Good. Now I'm going to palpate your carotid pulses one at a time. Got a +2 over here. And a +2 over here, which is good. All right. Now I'm just going to palpate your lymph nodes. Let's start over here. All right, good. Nothing appears to be abnormal or enlarged or anything like that, so that's good. I'm now going to evaluate the jugular vein distension, so I'm going to have you lie back. Sit on your head. Okay, good. I don't notice any distension of the jugular vein, so that's good.
Okay.
All right. All right, that's good.
Now I'm going to assess your hands. I don't notice any scars or lesions. The temperature is warm and dry. No excess moisture. Capillary refill is present. I'm going to test for clubbing. Oh, okay. No clubbing. I'm going to look at the upper extremities now. I don't notice any deformities. Everything looks symmetrical. No scars. No lesions. I'm going to palpate now. Let me know if you feel any pain or tenderness. Not? Okay. Temperature is warm and dry. I'm going to assess some pulses. Radial pulse +2. Brachial +2. I'm going to assess for epitrochlear lymph nodes. I don't notice any, which is a good thing. None. Okay. And now I'm going to do some range of motion. Just follow me like this. And then I can make like this. And then can you grab my fingers, testing for strength, okay? And then can you like this with your wrists? And then I'm gonna assess the range of motion of your elbows and then of your shoulders. Okay, I'm going to assess the tricep reflex. You could just relax your arm. Okay, perfect. Going to be assessing the posterior chest. Looking for muscular development, which is good. Scapular placement is equal on both sides. No dyspnea noted or troubled breathing. I'm going to palpate the spine for good alignment. Everything seems to be intact and appropriate. I'm going to palpate for pain now. Let me know if you feel any pain. Nope. None? Okay. And then I'm going to do tactile fremitus, say 99. Each time move my hands.
99, 99, 99. 99.
Okay, and then I'm going to lightly tap each side. Let me know if you feel any pain.
Nope. Nope.
Okay, good. Now I'm going to take a listen. Each time I move my stethoscope, take a nice deep breath. I'm gonna listen to the sides too, so if you could place your hands on top of your head. One more. Last one. Okay, good. We'll move around to the front now. Okay, I'm looking for any pulsations or heaving, which is none noted. Skin color is still appropriate. I don't notice any trouble breathing. I'm going to palpate for the PMI. Okay, so I'm going to do tactile fingertips on the front, just like it did on the back. Say 99 each time, move my hands.
99, 99, 99, 99.
Good. And now I'm going to take a listen. Another deep breath each time I move my stethoscope. Listen to some heart sounds now. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, good. Now I'm going to move on to the abdomen, so if you can go ahead and lay down, please. Okay. Looking for the contour. Contour is flat. I don't notice any lesions or scars. No abnormal pulsations or peristalsis. I'm going to go ahead and take a listen now in all 4 quadrants. Or listen for any venous flurries or humps. Aortic, renal, iliac, and femoral. And I'm going to palpate lightly in all 4 quadrants. Let me know if you feel any pain or tenderness. Any pain? Nope. Okay. And I'm gonna have you raise your head up. I'm gonna palpate the umbilical region. Okay, good. And then can you touch your head to your chin? Or your chin to your chest? Any pain?
No pain.
Okay, good. So that's negative for Brudzinski's. And then I would lightly palpate the femoral region for any bulges, pulses, or lymph nodes. Okay, and now I'm going to move on to your lower extremities. Okay, everything's symmetrical on both sides. No scars, no lesions noted. I'm going to go ahead and palpate for any pain or tenderness. Any pain? Nope. Okay. Temperature? Warm and dry. Test for capillary or pitting edema. Not noted. Then I'm going to assess for some pulses and capillary refill. Capillary refill is present. Pulses, fetal pulse +2, posterior tibial +2, and then I'm going to assess your popliteal to turn on your stomach. Relax your leg. We got a +1, and flip that over, please, if you could. I'm going to test for some range of motion. Can you go ahead and lift one leg? Lift the other leg. Can you bend your knees? Okay. Can you rotate your ankles? And can you wiggle your toes? Okay, good. And then I'm gonna test for Kernig's. I'm gonna have you raise this leg, bend it, and then extend it. Do you feel any pain down your spine? Okay, so it's a negative Kernig sign. I'm gonna have you swing over to this side of the bed. I noticed your ease of movement was appropriate. You didn't have any trouble sitting up. I'm gonna do a patella reflex now.
Oh, for the kidney?
Oh, okay. Okay, I'm gonna have you stand up. I noticed you didn't have any problem standing up. Can you try to touch your toes? I'm gonna palpate the spine. Okay, feels good, appropriate. Then I'm also gonna test the cerebellar and motor functioning. Can you close your eyes? Do you feel dizzy? Okay, good. And then fine motor skills, can you alternate touching your fingers to your thumb? Okay,